This video has been produced by the Chichester Home Enteral Feeding Dietitians for use at St Richard's A&E, how to replace a balloon gastrostomy tube. Check the stoma has been established for more than 6 weeks. If it hasn't, then this procedure should be carried out in endoscopy. If the patient has had their tube in for 6 weeks, the stoma site will be well established. They will come into A&E with a red emergency folder, which contains written instructions on how to replace the tube, the type of tube that they have. If they don't have this with them, then you'll need to get the correct tube from the A&E supply, which is in a red folder in the storeroom by the nurses' station. To find out which is the correct size, either ask the patient or examine the old tube brought in with the patient, or refer to the end plug that they may have in place. The colour of the end plug refers to the correct tube on the front. Gain verbal consent from the patient or carer and examine the patient. If there is an end plug in place, the tube replacement should be successful as it's holding the stoma open. If there is no end plug, check how long the tube has been out for. The stoma can start to close after approximately 1 hour, so be prepared and bring a smaller replacement size as well. Check there's no obvious trauma from the old tube removal and the patient isn't experiencing pain at the site. Gather your equipment. You will need a sterile dressing pack, 1 balloon gastrostomy tube of the correct size, a Lewis slip syringe, sterile water or freshly drawn tap water, water-soluble lubricating jelly, 60 ml enteral syringe and pH indicator strips. Position the patient in a comfortable position, ideally lying flat on their back. Wash your hands and using aseptic technique set out the required equipment. Open the new gastrostomy tube, checking that it is the correct size and is in date. Loosen the external fixation device on the gastrostomy tube. Using a Lewis slip syringe, inflate the balloon with the required amount of water. Inflate the balloon on the gastrostomy tube to ensure that it is not damaged and is evenly inflated. Manipulate the balloon so that it is even. Deflate the balloon again using the Lewis slip syringe. Close the cap on the feeding end of the gastrostomy tube. Apply lubricating jelly to the end of the gastrostomy tube. If there is an end plug in situ, then remove this with a gentle motion. Gently insert the new gastrostomy tube into the stoma. Stoma tracts are usually 2 to 5 centimetres long, so the tube needs to go in at least that far. Use the measurements on the side of the gastrostomy tube as a guide. Remove a small amount of gastric aspirate using a 60 ml syringe from the feeding port. Test the aspirate on pH indicator paper. A pH of 5.5 or less indicates the correct position. Inflate the internal balloon with the correct amount of water. This is usually 5 ml. Use the coloured inflation port. Gently pull on the tube until resistance is felt. Push down the external fixation device to the correct position. This is 2 to 5 millimeters from the skin. Flush the tube with 60 ml of water to ensure there are no leaks and the patient is not in any discomfort. If there is any bleeding from the procedure, this should be minimal, and a piece of gauze can be loosely placed under the fixation device to protect their clothing. Dispose of the waste correctly and wash your hands. Please contact the dietitians on extension 31776 to inform of the tube replacement. We will then follow up in the community on our next working day. Thank you.